This talk describes an osteopathic approach to orofacial myofunctional disorders. We could have called it tongue function and full body breathing. All of the references and links mentioned are in the description below. Alrighty. Good morning and welcome. Myself, Michelle Veneziano, DO, and Carly Schneider, orofacial myologist, have put together new slides to help the world understand the relevance of tongue function to systemic health and just about every case that walks through your door, regardless of their age. I thought I'd list our objectives today, which is to understand the clinical relevance of healthy tongue function. And of course, what is it? And if we don't have it, how do we achieve it? Learning to identify orofacial problems in the office. And then what is it that we need to collect to support ourselves in our ability to assess these patients and educate parents? And then learning how and why to refer. So the concept, this is the osteopathic concept. Actually, nature did this, and then a brilliant Belgian osteopath created this visual that ties it all together and explains the destination of everything we're doing is the body breathing as a unit from head to toe. And not just in a physical sense, but an energetic sense. And in osteopathy, we call this energetic breath the synchronizing of the subtle cycles of expanding and contracting in all things in nature as it occurs in the body, the primary breath. That's a term in osteopathy, primary respiration. And it basically represents coupling with the cycles of the planet. There are different rates, and that book, Lindy, that you referenced, Breath, goes into the math and the history, and it's really done a brilliant job tying it even to tempos of mantra in ancient lineage going back thousands of years. Knowing of and seeking to entrain with nature in our optimal state. So here's this wonderful visual from this Belgian osteopath, and it shows that there are multiple diaphragms in the body. We begin with the head. Of course, this is exaggerated, but skulls do cycle. There's a subtle expanding and contracting aspect to all anatomy unless it's compressed, fixed in some way, halted from participating in this global breath. And the end point of every osteopathic treatment is achieving this full body synchronized spring-like action. And it's quite literal. Even in my elderly patients, when we achieve this, they can fall, they can have a car accident, and they can spring with the injury and recover much faster. I'm just going to show this one more time as I discuss how is it that the tongue is relevant to this. The tongue is so relevant to not only achieving, but maintaining this full body expanding and contracting coupling of primary and secondary respiration. Every cell participates from head to toe. And the really great athletes in the world have this innately. They have this efficiency. It's like a physical flow state. And then this state also represents an integration of the electrical body, the subtle body, and the nervous system. So when we talk about how do we address, stabilize the nervous system of a kid who can't sleep or who's had trauma or fill in the blank, ultimately this endpoint is what will land them back in range of nervous system stability and the ability to then progress and move on with their lives. So because of everything I just said, I coined this a while back, and I just have to say it over and over. A well-functioning tongue is like having an osteopath living in your head. Once that spring action is achieved, either the kid was born with it or they've somehow gotten through birth trauma with enough breastfeeding, which is much more than most of us have, 3 to 5 years, apparently, from different dentists back in history, traveling to different tribes saying, we have good facial development in this tribe. These are their practices. No one in the Western world really does what would achieve naturally without assistance that kind of synchrony and efficiency that I just showed in that first visual. So The tongue maintains it or helps us get it back. And it also is almost like a set point to the integrity and full expression of the central channel, a midline axis, which in osteopathy we call midline, and in Taoist medicine they call central channel, and in Vedic medicine they call samsara, something like that. I seem to forget. Big picture, how does the body work and how do we know it's fundamentally more fluid than it is solid? Well, firstly, because that's what math says and that's what physics says. That, the translation of what we know in physics to actual medical practice is lagging greatly. Think about this example. This is a heartbeat motion in the tissues of the brain. This is an enhanced image on the right, exaggerated tenfold. But here's the point. A heartbeat alone is moving every cell in this head, including a subtle flexing of the bony container. If you look closely, and I don't know if this version is that visual to you, but I'm going to give you a copy of this with the actual study so you can go back and look really closely and internalize for yourself what's happening at a cellular level that really goes beyond our idea that the skull is fixed and the body can't be remodeled. This whole concept of neuroplasticity actually applies to every cell and every function in the body. So opening your mind to realize that regardless of age, we work with restoring the integrity of tongue function to address apnea, brain. It's important for the head to breathe. It doesn't matter how old you are. And you can work with this mechanism at any age. It's just harder later. For sure, it takes more work. So I have this analogy. Think about how the cilia and the throat are microscopic. We wouldn't know they were even there if we didn't have microscopes. And yet they're responsible for mobilizing the vast majority of mucus in our airways. So that's the concept. Tiny, consistent action is more powerful than anything we can do in an hour with intent to influence a system. You will become the shape of how you breathe and walk and sit and think. Why is the tongue such a powerfully and clinically relevant influence? It's huge. So we just saw how a heartbeat, a tiny little heartbeat, affects every cell in a cranium. Well, the tongue exerts 1.5 to 6 newtons. That's 100 to 600 grams of pressure, depending on the action of the tongue with every swallow. 1 to 2,000 times a day, this powerful force is either supporting this integrated expanding and contracting that maintains the wetland of the body or not. Carly in the orofacial myology world calls it the rudder of the ship. I call it the placeholder of the reference function that allows everything else to happen. So to give you a sense of the relevance of that amount of force, orthodontics can use only a maximum of 1.7 newtons, which is 180 something grams of pressure to move teeth before there's too much tension for blood flow to get into the gums. And we start to see receding, we start to see decline. And so the tongue, with this pulsing, every time we swallow, if the tongue's doing its right thing, it's basically expanding the palate and it's pulsing the entire cranium. And we're going to see in a minute the vector of force from where it begins to where it goes and how centrally acting that influence is on this full body breathing. Because when you land a kid in that full functional respiration, they can heal. The body will take care of a whole bunch of stuff. Your problem list will get really small. So let's see. Tongue forces hugely influence development of face, head, neck, and of course influence vision, brain, drainage of ears and sinuses, posture, nervous system. Did I put immune system? I need to add that. Are heavily influenced by what the tongue is doing. So this is often what happens. Let's say we have a healthy kid, their birth was fine, they breastfed, they have decent tongue function, and then they get a pet or they get an allergy to a food. And all of a sudden, They're obligated to breathe through their mouth, and the tongue must drop. So, Lindy, this is getting at what Carly was telling you to start to look for. What happens when the tongue drops? And not only does that whole midline electrical connectivity get scrambled, but these very powerful lateral muscles, the masseters, the muscles of chewing and swallowing, are now moving medially under opposed by the tongue that is no longer able to rest in the palate. And this is what we see. I just have the kid look at the ceiling and open their mouth. The sides of the upper teeth are flat, so we usually have some kind of pyramid looking thing. Depending on what the tongue's doing, though, if the tongue's going off in some thrust to a side, we'll have all kinds of crazy arrangements. The tongue is basically determining what the teeth do. So the idea of fixing a distorted bite just by straightening teeth without addressing the underlying cause is very short-sighted. When we do restore tongue function, we get a whole host of other benefits, including nervous system stability and more functional airway. We actually have the airways undergrow without the tongue doing its right job, and I'm going to show you a visual on that shortly. This is a comparison of natural growth with chewing and swallowing, rightly developed by way of breastfeeding typically, and maybe an osteopath having to decompress the skull so the tongue can actually do this. That's why we're partnered. Sometimes the tongue isn't enough with the kinds of patterns we see with modern life and modern levels of difficulty with pelvises being too tight, moms being too stressed. So we have this forward and downward growth, which is also happening in the airway. So we have a wider AP diameter to the trachea, and here we have the mouth breather. We don't have the AP diameter coming in. We have all sorts of other things. We're going to look at the details of those in a second. And then a reverse swallow can actually move bones more posteriorly, creating even more compression on the airway. So comparing the outcomes of, let's say, a person on the left who was breastfed enough years to overcome whatever occurred in the birth canal. And don't get me wrong, the pumping, the birth process and the pressures of the contractions are necessary to prime the separation of the plates and begin to have them relating in this way that they participate in respiration. We often find the hardest patients are C-section babies because they never had that. They'd have these skull plates that never realized they were separate, and we call it bowling ball heads. How do we go back in time and recreate that initial priming experience? It's actually the hardest thing to do. And we'll find that in adults with head injury as well. We'll find it in kids with good motion who then have a bad head injury later. The skull will fix. And then you'll have all of this crowding or failure to expand in the anatomy. And tongue function isn't enough because all the force vectors have to be neutralized from head to toe for the tongue to be able to shape the body from head to toe, which is what it's capable of doing. So clinically, you'll see the comparison. This example on the left of a nose breather, it's pretty rare that we have a pure nose breather. And what happens with these people is they have really lovely facial proportion. Are supermodels. They have this exceptional level of balance and harmony and beauty in their face in a sort of golden mean sense because nature expressed fully. Somehow they got lucky. This person will have the profile will be balanced. Their resting lip posture is relaxed with the lips sealed. Lips being sealed is something to look for. There's actually a reflex with the brainstem that tells the tongue to go to the palate with the lips touching. And some of the devices for kids achieve just that. They don't even go into the complicated orofacial myology exercises. Some kids are too little to do them anyway. But just achieving this lip seal somehow wakes up the brainstem to begin to drive the tongue the way it needs to be informed. So we'll see good jawline, we'll see high cheekbones, we'll see stacked cervical posture where the ear is in line with the shoulder. And by contrast, we see air-seeking posture here. And what that is this forward action is actually how we open the airways. It's the same thing we do when we intubate and our ability to visualize the cords, and it's our best view of the airway. So the person is unknowingly unable to sit straight. Their airway won't be wide enough to breathe. So sometimes, in fact, often people have intractable back pain. They've tried everything because their spine will never be in neutral. Breathing trumps everything. ABCs applies. So lots of times I have to treat their head to get them out of their back puzzle. We're lacking in understanding that everything happening in the pelvis is happening in the head, hence the term craniosacral. Osteopathy is the source of the whole field of craniosacral. And the whole point of craniosacral is this restoring this rhythmic breath. If you don't have a rhythmic breath, your back is going to also, your entire spine and your limbs and your joints and your organs will all be taxed. And that article that I shared with you, I hope at least touched on that. It was really hard to summarize how many systems are affected by these mechanisms that we're talking about. So the kid will walk in, they'll be slumpy, they'll be punky, they'll be tired, they'll have allergic shiners, they'll be dopey because they're just not sharp, they're just foggy. And they'll also have this distorted profile, and they'll have small jaws typically. There are a lot of variations, and I'm going to have Carly get into more of what her specialty is. I'm mostly the fix the big picture person. Here's one case where this is the classic, call it the high arch palate with the flat sides, kind of a steeple shape bite from the masseters being underopposed by the tongue that we saw in that first video. And this is what you'll see. And then we just get the bones unfixed, train the tongue to grow the anatomy out and down. And then we kind of have a nice ultimate effect of cosmetic improvement. The cosmetic outcome is the least of the benefits of restoring the tongue palate integrity. So here's an example of the mouth breather on the left, the underdeveloped face. We didn't have the skull move forward and down through the influence of chewing and right swallowing with the tongue on the palate. Some of that's because our foods are soft. This is a pictorial of how drastically minimized the airway can be when the face undergrows. So it's really common to see an airway half of what we would expect. And then as we begin to grow the face, we begin to decompress this whole area. And you can imagine if a kid has allergies and the mucosa gets swollen, and then we have the surfaces touching and the uvula touching the posterior oropharynx. That's cranial nerve 10. This kid is blowing out their vagus pathways. Adults can do it too, where we see not restful sleep, heart rates and breathing rates don't come down into range of deep sleep. James Nestor's book also goes into the difference between the physiologic ranges that are revealed by nature and ancient systems to what we learned in medical school. Normal respirations, 14 to 18 respirations per minute range, not even close. Actual balance function is 11.5 respirations per minute, which is the pulse of the planet. At rest, obviously not when we're physically active. And here's an example of what used to happen a lot, which is we have these underdeveloped, mostly maxillary mid-face areas. Maybe the person has an underbite. And what they have done, which is less the convention now, thank goodness, but it was quite common 20 years ago when I started, is that for cosmetic reasons, they'll grab the mid face and the lower face and they'll pull them in line with the underdeveloped upper face. So this was actually imaging from an orthodontic journal, and they were bragging about the accomplishment of this case. They didn't look at the airway. So when the kid comes in, your history might include, my impression is that allergies are a big culprit. You might have the report of difficult birth, fussy baby, fussy eater, hard to potty train, lack of coordination in sports. If the child has had braces or headgear, sometimes we have so many forces being put into the system to balance the anatomy without paying attention to the function. And we actually have to treat those out. We actually have to say, I'm so sorry you just spent all this money and time. But if you want your kid to be able to function in school, we actually have to step back through what unfortunately was insult added to injury. And that's not always the case. Sometimes braces are perfect. So let's say you breastfed your baby for 2.5 years. That's what I did. And then this was what, 2007, 8. I was so tired. I was going back to work. I vaguely knew pacifier is not good, but I don't care. I'll fix it later. I have been paying for that for 17 years. She's a teenager. Well, she just turned 20. They eat crap and then they get congested and then they can't breathe through their nose. And then the body has memory for this whole dissociation. The thing that gets her paying attention is that her face shape will start to change. The history might include disruptive sleep, breathing problems, clenching and grinding, signs that the nervous system's being activated by the compromise to air entry, ABCs. And the steady state function we're talking about goes all the way down to metabolism at the mitochondrial level. The whole body's needing to rest in a really efficient idle where all the systems are talking, and the whole function of metabolism can proceed mostly while the kid's sleeping. And then we also see GI dysbiosis. Sources could be the nervous system is overstimulated. They're also swallowing air when they're breathing through their mouths, so you're compromising the microbiome by changing the environment in the gut. And what we see are frequent infections, difficulty learning, and of course, ADD. And then on physical exam, we've gone over a lot of this. The mouth breather has the high arch palate and the crooked teeth. The kid's often congested. There are large tonsils, allergic shiners, kids tired, and then they slouch and have this air-seeking posture. They also can be hypermobile, very flexible. When the nervous system's not balanced, we're metabolically compromised, so we're not anabolic much of the time. Growing comes from our excess, not when we're conserving resources to just cope and be in a survival state. So we don't really have the integrity to the collagen in the tissues in the constantly autonomically activated kid or adult. And of course, facial asymmetry. Face not proportional in thirds. I have a visual on what that is later. And all the other things. Retruded jaw, poorly defined cheekbones and jaw, signs of clenching, wear on the teeth, speech impediment, lisping, lip licking, nail biting, lingual and labial freedoms I'm going to let Carly talk about, but I do have an image. And then this cool thing called torus palatinus. Is that on your radar as a thing? So I'll show you what it is and then backtrack. This is another thing to look for in physical exam. You're going to see them in kids and adults, and what it indicates, because bone takes the shape of the forces acting upon it, and that is simply a principle of nature, that this suture's not moving. Let's call it a wave transmissibility or a capacity to flex at that junction. If that's missing and the forces of the face are doing other things, often we'll see these huge lumps of bone in different places in the mouth, but the roof of the mouth is a very common place. So the idea is to learn your physiology a little deeper and think function. Osteopathy is form follows function. It's a really beautiful complement to an allopathic medical education, just even to get the basics and expand how you look at your patients. So this is fun. Let me just show you this spot. So this spot at the back of the palate is a meeting place of four bones, the palatines and the maxillae. And this junction it's very soothing. thumb sucking and other kinds of oral habits will seek to stimulate or pulse this area. Not that that's great, it's really the tongue's job. But let's say the head's too fixed and the tongue can't quite open it up. The child will be looking for extra ways to scratch this itch. And thumb sucking is one of these ways. And if you take a look at the diagram on the right, this suture, crisscross suture, the cruciate suture is actually its name. The vector of motion from the tongue giving that 1 to 6 pounds of pressure, 1 to 2,000 times a day, if it's strong in the back, which most people's aren't, goes right through to the body of the sphenoid. If you want to activate the spring to get the whole body able to do this expanding and contracting behavior that has us even resilient as adults to trauma and falls, so even relevant for the elderly patient dealing with sleep apnea and trying to restore responsiveness of the airways, including lifting of the tissues. We actually produce nitric oxide in our sinuses, and when we breathe through our noses, we harvest that. Lindy, I don't know if you know about that. Nitric oxide is active on erectile tissue, which tissues of the throat are. So the body has the ability to actually change which nostril the air flows through. And that's one of the ways that we regulate what's happening through the cycles of the night. Every 30 minutes to 3 hours, the body, if the physiology is available, will shift inhalation from the left side, which is parasympathetic, to the right side, which is sympathetic, and balance the nervous system that way through the night. Breathing goes really deep. So let's see, there's our X marks the spot. Although in orofacial myology, they consider this anterior junction, there are actually 4 bones here too, the premaxilla and the maxillae. This forward junction is an important spot too. Carly thinks this one's more important. I'll let her clarify. The point is the tongue really needs to be doing this. It needs to cover the whole palate. And it needs to be suctioned up there without work happening. This is the resting place of the tongue. This is a really famous example. You'll see it on the internet all over the place. Age 10, this well-formed face, probably breastfed for 3+ years or didn't have a horrendous birth, probably wasn't the firstborn, got a pet. Allergic to the pet, obligated mouth breather. 7 years later, the shape of the face changed this drastically based on the tongue no longer opposing the powerful function of the masseter muscles of chewing and swallowing. And I was just watching a show with my daughter one day and I spotted it. Look at this gal on the left. She's slouching, the ears way forward of the shoulder, her facial profile. She's got the forward neck, air-seeking posture. She's slumping. She doesn't have any power. You can imagine the tongue is not there to be the rudder of the ship, to keep that central channel powerfully expressed. By contrast, this girl on the right is naturally sitting up straight. This looks like things went well for her from birth. It was an instantaneous ouch. Look at the hyperkyphosis and the general deflation. Sure enough, in the next frame, her mouth was full of braces and this gal's wasn't. So it's a whole picture. Teeth alignment is just the tiniest part of it. We do a lot of analyzing of progressive regrowing of kids. And this was a combination of a dentist. Sometimes it's helpful to have an appliance that mimics the action or the stability. It actually has a little loop that touches the palate in that critical place that has that electrical circuit that I'm referring to over and over supported. We have autistic kids or kids with other really significantly compromised nervous systems who just need a little bit of nervous system stability just in order to be able to be retrained. They need something holding them together while we piece things together. And that's called the ALF appliance. So in an adult, if you, again, Google meditation position, you mostly get this. Same business. This person's not relaxing, their mind's not quieting, they're not getting the benefits of meditation, most likely. I'm just looking at her and I'm tense. She's not breathing. There's nothing soft and effortless happening there. Again, we have the classic distorted aquiline profile. Jaw definition is lacking. We have the ear quite a bit forward of the shoulder. And then we don't have this effortless stacking of the bones, and this midline powerfully expressed central channel just has everything fall into the highest efficiency mechanically and electrically. So in yoga, we talk about the crown of the head moving toward the sky. That's quite literal. And the root moving toward the ground. These are measurable vectors of force. We also talk about the positive ionic charge of the atmosphere and the negative ionic charge of the earth. And everything we do is about existing in that polarity, connecting to that polarity and allowing that massive battery to do the work for us. And all of martial arts and yoga is based on this. How is it that people do these seemingly inhuman, impossible things like mobilizing force through one pinky to break a huge stack of boards? It's because of logging on to this larger thing and letting the power of the earth come through in this focused way through this intact central channel. So we call our osteopathic oral facial myology school ninja school. The kids get excited. And then here's an example of proportion. You can look at the kid from the hairline to the space between the eyebrows, and then from that same line to the bottom of the nose. And you can just get a gestalt sense of how much proportion do we really have. Not tons. In most people, you'll see. And Carly's going to go a lot more into frenums. And this is a tricky area. I've seen the trend and the research. They don't really all need to be repaired. They need to be assessed as to whether or not they genuinely impact function. And I'm waiting myself to get up to speed through Carly. It's a little foggy of an area for me. So clinical cases. One great example of tongue function and full body breathing affecting the nervous system, and by way of the nervous system, the immune system, is this excellent case. I saw a 10-year-old boy from your practice who was on his third course of antibiotics for pandas. He couldn't get off them. And I noticed he was a mouth breather. So within a few treatments, we got his head loosened up. The tongue was able to restore to its rightful place on the palate. He was no longer mouth breathing at night. He started sleeping better. He started gaining from all of the benefits of air entering through the nose, which are multiple in terms of immunity. And he resolved and was no longer dependent on prophylactics. Another example that was speaking more to the effect of tongue palate dissociation systemically and on coordination in terms of sports and also metabolism. I saw two boys at my daughter's swim class in the pool. They were twins. One was fit and had good posture and was really coordinated in the water. And next to him, and I didn't know they were related, his brother was flailing in the pool. He was much heavier. And when he got out of the pool, his mouth was full of braces. He was such a classic case of all the things that we're talking about going wrong. I spoke with the coach and he explained that the two boys were twins and planted a seed so that if the parents wanted to go digging, they had resources to do so. A case of an older person. This woman, 45 years old, with extreme dysfunction, and after 7 years of osteopathically informed dental appliance work with the ALF, Advanced Light Wire Functional Appliance, which I mentioned before, mimics tongue palate connection so that the nervous system can come into focus and be retrained in combination with tongue training, orophacial myology, and osteopathic work. These are models of the upper palate and bite. This model below represents before, And this expanded dropped palate and well-formed bite above is 7 years later after all of these interventions. With kids, this entire process can take a handful of months. Any child under age 14 is easily remodelable, and the earlier we get them, the better. Well, osteopathy can begin at birth, which is highly, highly recommended to avoid much of what we're talking about right out of the gate. And then addressing dysfunctional frenums. Not all of them are needing to be treated, but some of them are. The tissue that prevents the lips from sealing or prevents the tongue from rising to the palate sometimes need to be addressed surgically. And then the training of the tongue in any number of ways that we do this, which depends on the age of the child. In closing, we've mentioned many times, referenced this wonderful book by a journalist, James Nestor, in which goes into a lot of the research and also a historical retrospective on how this whole tongue-palate dissociation came about through modern practices such as soft foods and changes in the ways that we birth, and also dissociating the tongue and palate with oral habits like thumb sucking, use of sippy cups, and others, which we'll see in more depth when Carly Schneider, our orofacial myologist, gives part 2. And then I wrote an article, which is on my website, flowismedicine.com, under blogs, that summarizes everything I spoke about today. And then also a website, the International Association of Orofacial Myology has a link to over 300 studies relevant to everything from how nutrition affects development of the face and all of the ways that we identify and address this stall in development. And there are a lot of great studies that have been done, especially in the past 10 years. So that's what this looks like. My last slide is time for a stretch. We've been sitting here for quite a while, and I'll open the floor to some questions.
Thank you. I'm just taking notes and letting this all sink in. One thing you mentioned was like appliance or tools that can be used. I've had families ask about either direct to consumer or over the counter options. I don't know if they sound very different, but the ones that have come to mind are a Myo Munchie and a tooth pillow for older kids. And I don't know if Carly could speak into these as well, but is there any, outside of being able to see a
I
proper.
actually want to leave that for Carly because
Okay.
I want an update on that too. I was
Okay.
really impressed with the Froggy Mouth. It's a comfortable sleeping device for young kids. It speaks to lip seal. Lip seal is a reflex to have the brain stem respond well to the tongue getting information that it needs. And last I knew, it can simplify things a great deal. I don't actually treat kids much. I treat the kids of my patients because I'm more wired to address these older, more complex cases. Carly's the expert. She goes to lectures and trainings all the time. So I'm going to leave that question for her to refresh for all of us.
Great. Okay.
I was just curious. So we get C-section babies from time to time, and would you recommend automatically sending a C-section baby to either an osteopath or a craniosacral just to get those bones moving and train that?
I would. If there are any shreds of any issues, including just a fussy baby, and you don't really see anything, every baby should be treated 2 or 3 times. One of the sayings in our profession is, as the twig is bent, so the tree will grow. And in this newborn window, stuff resolves like that. They're still so fluid, even within the bone. Because the bone's so fluid, the architecture can actually twist. They can actually pattern in something non-physiologic. Vacuum will do the same thing on the brain parenchyma, which is a huge trauma. We don't think vacuum should be used at all. 4 steps in trained hands is far superior.
Hmm.
Of course, in trained hands is tricky because vacuum is more the convention now because it's so much easier to
Mhm.
perform.
Two things. First of all, the slide that had the frenulectomy, I didn't quite understand that one.
I actually didn't talk about it. Apparently, the thinking in the profession has shifted. We're doing fewer frenectomies. The first step I would do is assess for whether or not it's actually a functional impairment. Definitely, Carly knows which dentists do what. What are the factors that would lead to success? Any level of complexity, I refer for this. Anything else before I finish up here?
This is wonderful, Michelle, because I don't think any of us MDs really know what osteopathy is. I really appreciated even just seeing what the heartbeat does to the brain and understanding the movement and the breath and all of that. We definitely need the piece, Carly's piece, the oral facial myology. So I suspect that's a separate lecture.
Yeah.
I think there's so much there. I'd love to have the time to explore the other side of the, yeah.
I've just got so much experience to offer, whereas somebody up there might just have taken a weekend course, and that always kind of scares me.
Exactly.
Truly, we're just sort of we're starting on the path for all of us to learn more about evaluating airway, the modalities that we can use for the kids, the supportive care, the appliances that are useful. So
In a month or two, we'll do part two. Whenever you.
All you have to do is ask.
that's great, Carly. Okay.
One last thing, the whole otitis, recurrent otitis. This is that restoring that pump is a highly essential thing.
Yeah.
Yeah.
We have a particular take on it over here. We almost never treat ear infections.
Excellent. Or certainly not with
And
antibiotics.
then they don't become recurrent, even
There
for
you
the
go.
kids.
Yeah.
There's a few oddballs. There's a few
Yeah.
outliers. Those are the ones that may have something to do with their airway, their pump, their tongue
Yeah.
position. Very much so. And that's good to be reminded. But we're
Osteopathy first, antibiotics or other treatments second for sure. We avoid it almost all the
Can I
almost all.
comment on the ear infection as well? So, it's like, where's the end of the tube, right? It's way, way, way on the back palate area. And the bacteria that lives in there and festers and causes a lot of the infection is anaerobic in nature. So how do we get oxygen in that tube is when we swallow correctly, which means lifting our back tongue up, we hit against that little opening, that little frame, and we flush air. I can do it right now. I feel like a shoosh, shoosh, shoosh through my ears. So that's, in my opinion, a really big part of the ear health too. It's one of my first questions on my health history. So a swallow pumps the eustachian tube is kind of what I'm saying, with oxygen to kill the bacteria.
Oh, that's a good question. Carly, can you share your intake checklist of things? Remember way back when we flew to Bronson's and Kathy Winslow gave us a history taking sheet, and I thought it was so useful, but I bet yours is more current and complete.
A great question, Michelle, because I'm just not we're going completely to the computer. I'm slowly moving there. And I'm gonna that's one of my projects this weekend is to get it. So I'll have it fresh and updated. So sure.
Great. Okay, well, we'll look for another date.
Yeah, that sounds good.
Thank you so much, Michelle.
No problem. That was
Fascinating
upsetting.
films,
Yeah.
watching the actual movement. Very
Right? It's something, you got to sleep on that for a couple months and let it really sink in. It's a big thing. Big. We're not solid. Take home. We're not solid. We're moldable forever.
All right, you guys.
All right.
Thank you.
So much.
Thank you.
Nice to meet you.
Care.
Bye-bye.